Hello everyone, I'm Dr. Musa, consultant paediatrician and neonatologist. Today, it has been more than 4 years since COVID-19 first appeared in Malaysia, leading to prolonged lockdowns, quarantines and even death. The country may have recovered from the challenging period by now, but are you aware that COVID-19 is still here? Let's equip ourselves with the latest update on COVID-19 as I attempt to answer some questions on the disease in this video.
What is the current status of COVID-19 in Malaysia?
Currently, more than 5.2 billion cases of COVID-19 and more than 37,000 deaths due to COVID-19 have been recorded in Malaysia since the first case was detected in the country in January 2020. Nowadays, daily new and active cases have been low and at a manageable level, with some surges from time to time. The latest surge in Malaysia happened in December 2023 when daily new cases rose above 3,000 and peaked at 5,000 cases on 20th December 2023. More recently, a new wave in Singapore was also reported in May this year. On the other hand, the majority of Malaysians have received the COVID-19 vaccine during the nationwide vaccination beginning in February 2021. Currently, 84.4% of the population have completed the primary doses, while 50.1% have also taken the first booster dose. However, the uptake of the second booster dose has been slower at only 2.5% of the population. All these numbers are now available and updated on the KKM NOW website.
Is COVID-19 still a major health threat?
According to the World Health Organization (WHO), as of June 2024, a number of COVID-19 variants are currently circulating. This includes variants of interest VOI like EG5, BA2.86 and JN1, as well as some variants under monitoring VUM like JN1.7, KP2, KP3 and JN1.18. There are no variants of concern VOCs in circulation presently. COVID-19 cases continue to be present in the community with sporadic surges, but numbers of severe cases, hospitalizations and deaths have decreased substantially since 2020 and 2021. This is probably contributed by the rising herd immunity due to prior infection or vaccination. However, COVID-19 still poses a significant risk to vulnerable groups such as the elderly, infants, those with underlying medical conditions, or who are immunocompromised. These groups are linked with higher rates of hospitalizations and death due to COVID-19. Apart from that, long COVID is still a serious concern among patients. Hence, COVID-19 remains to be a persistent public health threat that should be monitored vigilantly.
What are the latest guidelines for managing COVID-19 in Malaysia?
The Ministry of Health has released the updated COVID-19 management guidelines in July this year. COVID-19 patients are no longer required to undergo home quarantine, but they are still recommended to stay at home. They are also advised to avoid close contact with others and continue practicing other control measures to stop the spread of the virus. For example, wearing the face mask. If symptoms get worse, they should immediately go to the nearest healthcare facilities for treatment. COVID-19 patients will be treated similarly as other respiratory infections. Apart from COVID-19 patients, the use of face masks is still advised for individuals with respiratory symptoms like coughing or sneezing, especially when they are at a health facilities or in a crowded area with poor ventilation. Healthcare workers are also recommended to continue wearing face masks, especially when dealing with patients.
What is the future of COVID-19?
We've managed to mitigate the severe impact of COVID-19 on the population with proactive control measures and strategic cooperation. However, COVID-19 is here to stay with us. In the near term, countries should maintain COVID-19 vaccination programs, especially for the high-risk group, together with continuous monitoring of the vaccine effectiveness and other variables. In the long term, More data on the evolution of the virus and the trajectory of the epidemic should be gathered before deciding whether COVID-19 vaccination should be included as a routine vaccination similar to the annual influenza vaccination. I hope this video provides you with some beneficial information and updates on COVID-19. To learn more about vaccination, child health and related topics, please visit the Positive Parenting website as well as our social media pages on Facebook and Instagram. Thank you for watching.